Today, we're breaking down infectious bronchitis. All right, let's get right into it. If you keep chickens, this is an explainer you really need to see. It's one of the most common illnesses that can just sweep through a flock, and it can be a real headache.
So picture this. You head out to the coop one morning, and you hear it. A little cough, maybe a sneeze, or some raspy breathing. And then you go to collect the eggs, and they just look weird, you know? The shells are all thin and wrinkly. You're left standing there thinking, what in the world is going on with my birds?
Well, the culprit has a name: infectious bronchitis, or IB for short. It's a really contagious respiratory disease. But here's the part that makes everyone's ears perk up. Its other name is chicken coronavirus. Yep, it's caused by a type of coronavirus that's specific to chickens. And that little fact helps explain why it can spread so incredibly fast.
All right, so let's really dig into what we're up against here. We're going to start by looking at what this virus actually is and how it launches its attack on a chicken's system.
So here's how it all starts. The virus's first move is to go right for the trachea. That's the chicken's windpipe. This is what causes all those respiratory signs you hear, like the coughing and gasping. But the real danger, the hidden threat, is that this attack damages the lining of the trachea, and that basically opens the door for other nasty stuff, like secondary bacterial infections, think E. coli, to move in and cause a much, much bigger problem.
Okay, so what does this actually look like in your flock? Let's put on our detective hats and go over the telltale signs you need to be looking for if you suspect an IB outbreak.
Now, this is really interesting because the signs are completely different depending on the age of the bird. In young chicks, this disease can be absolutely devastating. They'll be weak, huddling together near a heat lamp, and they might be in serious respiratory distress. And even if they pull through, the virus can permanently damage their reproductive system. But for the adult hens, well, the breathing issues might just look like a common cold that's gone in a week. The real clue is somewhere else entirely.
And right here, this is the smoking gun in a laying flock. The eggs are often your first and biggest clue. You'll see a sudden, steep drop in how many eggs you're getting, and that can last for 10 days, maybe 2 weeks. And the eggs you do get are just poor quality. Thin, wrinkly, rough shells are classic signs. You might even notice that your brown eggs look pale. And if you crack one open, the white is often thin and watery instead of being nice and firm.
So, and this is a huge point, we're not just talking about a little chicken cold here. While it starts out in the respiratory system, some strains of this virus can actually migrate through the body. And these more aggressive types can do serious damage to the kidneys, sometimes leading to kidney failure, and they can also attack the reproductive organs.
So that begs the question, right? How does one sick bird turn into a full-blown flock emergency so incredibly quickly? Let's take a look at how this thing spreads.
The way it transmits is just brutally efficient. It starts simple. An infected chicken coughs or sneezes. That sends tiny, virus-filled droplets into the air. A healthy bird nearby just has to breathe in, and bam, they're infected. But it doesn't stop there. The virus is also in their poop, which means it can spread on contaminated bedding, feeders, waterers, even on your own clothes and boots.
And how fast are we talking? I mean, is this a slow burn? No way. Look at this number. Within just 24 to 48 hours of one bird getting sick, you can expect pretty much your entire flock to be showing signs. It moves like wildfire.
Okay, now here's something that makes this virus so tricky and, frankly, so scary. A chicken can get sick, recover, and look perfectly healthy, but they can still be a carrier, silently shedding the virus for up to 20 weeks. This is the hidden threat, and it's exactly why bringing new birds home and not quarantining them is one of the biggest risks you can take. All right, so let's say the worst happens. You've identified an outbreak. Now what? Let's switch gears and talk about the action plan for taking care of your infected birds.
So here's the strategy. First and foremost, you've got supportive care. You need to isolate your sick birds. Think of it as a little chicken ICU, a warm, comfortable, stress-free spot where they can easily get to food and water. Now, it is absolutely critical to understand this next part. Antibiotics do nothing against the virus itself. A vet might prescribe them, but that's only if one of those secondary bacterial infections has popped up. And you know, it's interesting, some early research has shown that certain herbal extracts might actually have some antiviral properties against IB.
We've gone through the disease, and now we're at the most powerful part, prevention. Let's talk about how to build your flock's best defense so you hopefully never have to deal with this. But before we go any further, let's just put this up on the screen, because this is the #1 non-negotiable rule. Whether you're thinking about a treatment or a vaccine, your first call should always be to a vet who knows poultry. Don't try to guess.
So really, it all boils down to this. A solid defense is a multi-layered one. It rests on 3 main pillars: vaccination, when it's appropriate, practicing really strict biosecurity every single day, and of course, having a non-negotiable quarantine period for any new birds you bring home.
Now, let's talk about that vaccine pillar for a second. You might be thinking, great, I'll just vaccinate. And vaccines are a super important tool for sure, but they're not a silver bullet. The reason is that there are just tons of different strains of the infectious bronchitis virus out there. A vaccine that works against one strain might not give any protection against another, and that's why biosecurity will always be your most critical line of defense.
And that really brings us right back to you, and to this final critical question. After seeing how fast this virus moves and how it spreads, take a really good hard look at your own setup, your coop, your routine, how you handle new birds, and ask yourself honestly, is your biosecurity strong enough?